morning and welcome to R&M News. I'm Mara Timlin.
And I'm Rebecca Robinson.
Today we will be covering all of the information that you need to know about the genetic disorder of hemophilia.
Our special guest today is Julie Lewis, a nurse who treats hemophilia daily.
Now we will cover some basic information. So what is hemophilia? Hemophilia is where your blood does not clot, and you would probably have to go to the hospital if you got a cut because you wouldn't stop bleeding. As if a normal person without hemophilia would just take it as an everyday normal injury and it would heal a lot faster.
A famous person who has this disorder is Ryan Wayne White. He is famous because his parents filed a lawsuit and won against the school. This is how he lived with his condition because of the money he won. He died April 8, 1990. 1,500 people attended his funeral.
Now we will get to our special guest, Julie Lewis.
Thank you. We are here with Julie Lewis, our guest of the week. Can we ask a few questions, Ms. Lewis, concerning the genetic disorder of hemophilia?
Yes.
Great. Our first question is, how do doctors help a person with this disorder? What are some of the side effects? How much does it cost?
Generally, the most common problem with hemophilia is bleeding, and it can be bleeding into the joints, easy bruising, or if there's any trauma, difficult to control bleeding. So in the hospital, we give factor concentrates to patients to help them stop bleeding, and if their blood count gets too low, then we give them red blood cells to replace what they have lost. And generally, the factor concentrates are very expensive. A 250 unit vial can cost up to $10,000.
Wow. Okay, so what do you do at work to treat hemophilia?
Well, at the hospital, we generally give the infusions at the hospital when there's excessive bleeding or uncontrolled bleeding. Sometimes people can do that at home if they've been trained, or if their parents have been trained, they can do it at home. But generally in the hospital, you give infusions through an IV to help stop bleeding.
All right, Ms. Lewis, our next question is, what are the newest research projects or medications that they are testing? How effective is it?
So one of the problems with the factor concentrates that you give to patients with hemophilia is that the lifespan of the medication isn't very long, and so once the body uses it, the patients can go back to bleeding very easily, fairly quickly. So some new DNA technology is helping to develop drugs that will, or factor concentrates that will have a lot longer lifespan and keep the patients from bleeding for much longer without having to get an infusion very frequently.
And what are some symptoms that your patients have had at work?
So again, bleeding is the most common symptom that people have, and it can be bleeding from minor trauma with cuts and scrapes, nosebleeds, bleeding gums, and also internal bleeding. And so, of course, with internal bleeding, patients can get a lot of pain. Hemophiliacs will bleed into their muscles, into their joints, and it becomes swollen and very painful. So you have to give them factor concentrates to help them clot, as well as pain medications to handle their pain.
Okay. Thank you for your time with R&M News, Ms. Lewis. Now we'll head back to the studio. In conclusion to this episode of R&M News, this is what you should now know about the genetic disorder of hemophilia.
The current research on this disorder. The research scientists are looking into is to find better ways to administer and to learn and better understand the paradox of their treatment. It is effective but very expensive, around $400,000 a year. The research is at Wake Forest School of Medicine, and it is being performed by some of the students. There is no cure yet.
How common is it that a person is born with this disorder? Well, for type A of hemophilia, 1 in 4,000 women get hemophilia, and 1 in 5,000 men get hemophilia. Worldwide, or both. For type B, 1 in 20,000 men worldwide receive hemophilia.
Treatment. What do doctors do to help a person with this disorder? The missing clotting factor gets injected to some of the bloodstreams using needles. Side effects and other issues that might pop up is less safe from viral contamination. The cost is $1 per unit, and there's about 25 units per dose. So for a 150-pound adult, they would inject 1,700 units, equaling $1,700 each injection.
Hemophilia is usually inherited and passed through genes. Sometimes hemophilia can occur when there is no family history of it. This is called sporadic hemophilia. If you inherit the genes for hemophilia, type A or B, they're on the X chromosome, which means it is a sex-linked disorder. People can also develop hemophilia later in their life, if you were wondering.
Great, and thanks for watching
RNN
News.